The most common eyelid tumor of the horse is squamous cell carcinoma. Um, Horses that have a bad gene are the ones that get it. It's called the tumor suppressor gene, and if they have the mutant form of this, they can get it whether they have a white face or a pigmented face or whether they're young or old. Uh, but in general, these are um, not young horses that get this. I have seen it in some two-year olds, but that's pretty unusual. It's usually the average age is about 11 for squamous cell to show up around the eye. So they need some persistent exposure to chronic exposure to sunlight and UV light. Pigmentation's protective, but not completely. Uh, and the most important reason that I think we all need to understand is there's some white-faced horses that get squamous cell and some don't. And what's the difference? The difference is the ones that get it are genetically predisposed. Increased squamous cell with in altitude. Uh, Once again, increase with age. Halflingers seem to be predisposed. Draft horses, paints. The least prevalence, the least affected breeds of horses are Arabians and thoroughbreds and quarter horses. There's a nice squamous cell of the nasal part of the lid. The squamous, I mean, you can get squamous cells, the eyelids, the third eyelid, conjunctiva and limbus. Uh, they generally are something that we will all consider highly in a differential for a fleshy mass around the eye. It can be there are other differentials for tumors around the eye, from papillomas and sarcoids, fibromas, and then inflammatory lesions from hyperemia and onchocerca, and then foreign bodies and granulation tissue can also mimic um, squamous cell. Uh, the squamous cells can progress. They can start off in the eyelid or conjunctiva and invade the bone. If the radiograph at the bottom, on the right side of the radiograph, right in the middle of the screen, is a dark spot, and that's where the tumor has invaded the orbit. It can kill the horse as well. It can metastasize to regional lymph nodes and go to other parts of the body. Treatment, well, basically what I'd ask you to remember is this: if you are dealing with a squamous cell around the eye, debulking the tumor if humanly possible, and then doing something else dramatically increases the success rate. Surgery, you can see the numbers here. A third eyelid squamous cell, 33% recur in 4 years. If the only thing that's done is surgery, it's 21% recur if you did surgery plus radiation. Well, I don't have that option anymore either, but I'd sure be, debulking and freezing if humanly possible, or debulking, freezing, and trying some topical chemotherapy. I mean, here's just an example. One of the types of surgeries to do: just an eyelid margin, uh, and doing the wedges here, removing the tumor and then sliding skin up to recreate the lid margin. Uh, the problem with this is horses don't have a lot of eyelid skin to slide, or facial skin to slide, but it's a nice drawing. Full thickness removal of the tumor, making the burrows triangles is what they're called, to let the tissue become mobile, to slide the tissue up and to where it replaces the um, missing lid margin. Uh, you see this in skin sutures here. The problem with this is it's hard to create a new lid margin. However, in a very large lesion, it's actually not that difficult to um, get to this point in the slide, and then just put dissect the conjunctiva on the uh, what's left of the lid, and just put a continuous and pull the conjunctiva forward, cover up the missing lid uh, skin, just cover it up with conjunctiva, put a running suture in it, a continuous suture, and just put one long suture in it and cover it up. It's amazing how well that helps these animals heal. I mean, here's a lower lid, really lid. This is a bit bad. This is bad lesion because it's so big. And there's just not a whole lot of tissue to work with.